Well, hello to everyone here today. It's so good to see you. I just want to really just do a little bit of a recap of an introduction of myself. I'm Kaye. I live here locally in Albury, and I have been doing a series of programs on natural health, simple natural health. The first two programs that we've already completed are on poultices. Poultices part 1, poultices part 2. And I might like to add that there are more poultices which, if you were interested, we could do. There are more classes that we can do, but I'll talk about that later. Today, I'm going to talk to you about hydrotherapy. Now, hydrotherapy is water treatments. Hydro, obviously, is water. And it is very, very powerful. I think most people do not understand the power of hydrotherapy. But I also want you just to think you can actually combine them along with the poultices that you have done. They all intermingle together. Often you will find hydrotherapy works better if you poultice as well. Poulticing, and sometimes you don't have access to all the ingredients to poultice. Sometimes you have access to water, and sometimes it's the opposite way round. So you've just got to use what you have, what you are able to use, and just try to help, and you will help heal yourself. Okay, now the use of herbs, juices and poultices and hydrotherapy will do more for the recovery of the sick than many realize. But people need instructions concerning the simple methods of treating the sick, methods that take the place of using poisonous drugs. And you can see down the side, I've got some photos of some classes which I've had in my own home. And there's an odd few people who have been to my classes, and they have seen it, and they have been, I have done the treatments on them, and they've just reassured me how much they have enjoyed it and how much help they've got out of the treatments. But I'd like to preface it with, these are what we call the 8 laws of health. Now, they're easy to remember if you spell out the word New Start. They stand for nutrition, exercise, water, sunshine, temperance, air, rest, and trust in God. Now, if you use all those laws of health, and believe me, they are a law of health, you can't do away. You can't decide, oh, look, I will be healthy, but you never exercise. It just won't work. You have to do them all. You can't do it without drinking lots of water. You have to have a combination of all those. And it's not for me. I'm not going to talk about those at all today because my program here is on water, but I just wanted to tell you that this, if you're looking at some problem in your body, you really need to go, because we call these the 8 doctors. They are the ones where you have gone wrong, what you have done, why your health is broken down, is because you haven't done them. And as I said, I'd like to go through them, but I can't. Okay, now water treatments, wisely and skillfully given, may be the means of saving many lives. And yet most people have no idea of simple water treatments, because believe me, I was one of them. Before I started this journey of my health education, I had no idea. I'd heard about hydrotherapy, and I asked some people, and they said, oh, we don't do it anymore because it's old-fashioned, because now we've got drugs. Well, I realise now that that wasn't very sound advice that was given to me, because I do realise the value of it now, very much so. But we must remember it is God who does the healing. Our part is to remain connected with him. And I want to preface that before I do any of my treatments here. When I'm treating with people and I'm working with people, I always offer a quick prayer to God, because I know he is the one who can do the healing. And it's his healing. He's the one who does. Okay, now hydrotherapy, water treatments have been used for centuries. You go back. Even the Babylonians have it. But who remembers the Spartans? The Spartans, there was a law passed in Sparta that everybody had to have a cold bath. Now, who would like that here? Okay, it's not so bad in the summer, but what about in the middle of winter? Hydrotherapy has more effect in the realm of pain relief than any other substance. And there's some stories, I've got a few little stories in your book about people who have regained their health, and primarily at the beginning, they regained their health by using cold water. They jumped in the river and they got their stamina and their vitality back. They had cold water, which is great. But can I tell you, later on down, as time and as the treatment started to evolve, they found that they had much more success by combining hot and cold. And I'll tell you why as we go through it. So that's what I'm going to do. Yes, there is a place for cold treatments, but more so it's a combination of the hot and the cold that does that. And pain relief, there is no peer. There's a man who had a hospital over in America in the 1800s called John Harvey Kellogg. He was a doctor at it. And they used water treatments, massage, and just like therapies like eating wisely and right. And he took in many, many, many patients, and people from all over the world flooded to his hospital. And he said that hydrotherapy, there is no peer in pain relief, meaning there's nothing that can compare with getting rid of pain that water treatment does. No other method is as effective, safe and easy, and free from side effects, and it has no equal. I want you to remember that. Okay, I want to share with you here I've got a book here called the Natural Remedies Encyclopedia. And I don't know if any of you have had it or have seen it. It is excellent. Now, in here, there is a whole section with pictures and photos on hydrotherapy. There's a whole section in here on herbs. Now, these books are quite heavy and they're quite expensive, but I've actually rang up. There's a man down in Victoria who actually has them, and he's willing to let me have them if they order, and they will cost you $60 posted here. $50 plus $10 postage. And if you feel the weight of them, they're nearly 3 kilograms each. So if you'd like to order one, and if you don't have the money, that's fine. You can just see my sister up the back table down there. She'll take your name, and as long as you pay for it by next week, right, I'll order some of these and we'll have them here. And I'll let you have a look down later at those, so you can just have a flick through and see if you'd like one of those. But I like it because it's got so many treatments, basic treatments in there of hydrotherapy, and I love it for that. And you don't often find books with hydrotherapy in it. You don't. I had a book, I can't remember where I've got it here somewhere, but by Agatha Thrash, and it's on Agatha and Calvin Thrash, and they were on hydrotherapy, and that's excellent, but so is this, and this has got so many other things in there as well. Okay, now blood equals life. If you have any problem in any part of your body, you need fresh blood to the area. It has every life-giving element to relieve, repair and restore. Now, what hydrotherapy does, it actually rapidly moves fresh blood into the area treated and takes the old blood away. So every time you're doing a hydrotherapy treatment, you're getting fresh blood to the area. It's not the same blood, it's new blood that's going through your body. Now, benefits of water treatment. By applying different temperature water to the skin in its different forms of hot, cold, ice and steam, and by different pressures will affect and send messages not only to the skin but the organs under the skin, and indirectly by means of a reflex response affects other organs as well. And this is interesting because your immune system stays elevated for up to 2 days after you do a treatment. And it's absolutely incredible because your immune system can probably, they say it probably increases 3 times. Okay, now let's look at some of the benefits of hydrotherapy. It increases blood flow, and obviously we know, and this is many times in a simple form. If somebody said to me, well, what good does it do? I would say, well, it brings oxygen, nutrition to your body, and it takes away waste. But I wanted to share with you the list of all of the benefits of hydrotherapy because I wanted you to understand and know how it is such a good therapy to use. It will tone up the body. It creates better and equalizes circulation. It detoxifies and rids the body of any accumulated poisons, improves digestion, stimulates the immune system, brings relief from pain, reduces stress, equalizes temperature. It affects the skin and relaxes muscles, increases range of motion, stimulates a sluggish or inactive organ because there's millions of nerve endings are stimulated. It calms the lungs, heart, stomach, and endocrine system by stimulating nerve reflexes on the spinal cord. It stimulates and soothes the entire nervous system, and it alkalizes blood, which stimulates phagocytosis. So isn't that incredible? You won't find anything. If they could put hydrotherapy in a pill, I tell you what, the person who would invent it or market it would be a billionaire. Okay, it is ready to work. We have 300 trillion white blood cells formed, mature and ready to fight battles. They are on reserve at all time. But on active duty are 60 trillion of these circulating in your bloodstream. Their number and the energy in which they can attack the enemy can be stimulated by simple remedies of hot and cold water applications. Exercise, fresh air, sunshine, and proper rest and diet. And remember, I'm not minimizing those other 8 laws of health. But you know, one of the law of health was water. And it says, the law of health actually says it's the proper use of water. And we're talking about a law of health that you need to drink water internally, but you also need to use water externally on your body for good health. And most people are not being told of that. Okay, now what are the effects of hot and cold? Hot quietens and soothes the body, slowing down the activity of the internal organs. Cold, in contrast, stimulates and invigorates, increasing internal activity. Now, what I'm going to do, when I'm doing this, I am going to create what we call a mini fever in the body. Now, let's just look at what a fever does to your body. When you get sick and you have the flu or whatever, you get a fever, your body will heat up, it will sweat, and it destroys your infection. Now, that is the body's mechanism for fighting infection. Your T cells are stimulated, they multiply, they become more active, they get stronger, and they do their job more efficiently. So you've got workers working in your body. So you have not only 3 times more workers working in your body, but they are also working much more actively. They are stronger, they get their job done, they're looking for a job, they become much, much more adept at doing their work. It's just like if you had a group of people and you had to clean up a room, or let's say a hall, and you have a group of people coming in to clean it up. And if somebody comes in and they're just on the broom and they just go slowly like this, and the other people, they just wipe things around like this, the people who are very slow, that is not like we're doing. We are stimulating your immune system to work super, super effectively. So it is going to do its job so far more effectively than you would under normal circumstances. Artificials can do this, but without the side effect, no washed out feelings. So if you have an artificial fever, and there's a number of them, I'm going to go through them as we talk today, you will get up and you won't feel washed out. Not like if you have the flu, you've had a fever, you get up and it takes you a few days to really get back to normal because you have that washed out feeling. Well, this doesn't happen with an artificial fever. Okay, now useful effects of artificial fevers. They increase your white blood cells in peripheral blood. Your chemical agents releases from white blood cells and they're less sticky. Now, most people, because of their diet, are having blood flowing through their body and through their arteries and veins, and it's thick. It shouldn't be thick. It should be just right. But most people, because of the diet, and it is so easy. I could share with you different slides and different things that if you just have just something with some oil in it, how easy it is to sludge up your blood. And there's certain foods it's like, sugar does too. All these foods, there's lots of things that can make your blood very sludgy and it's very thick, which is not good. Well, artificials will start thinning out your blood as well. Your blood flushes, your skin is purified, your wastes are eliminated because you are sweating. You are perspiring out your toxins. And it relieves congested organs. It equalizes circulation, and once again, it relieves pain. It stimulates a sluggish system or inactive organ. It increases phagocytosis and it quickens pulse and respiration. So that's the effect of an artificial fever. Now, how do we apply them? I'm not going to show, obviously, this is such a vast thing. And I was thinking about this and I thought that if I had a chance in my life again, I think I would have started years and years earlier learning about hydrotherapy. Because so few people know about this. And it's something that I believe is going to be so effective at helping people as we're going through the times we're living in. Hot and cold baths, hot and cold showers, hot fermentations. Now, by a fermentation, I mean, and I'm going to show you later how to do a hot fermentation. And that's using moist heat. There's a difference between dry heat and moist heat. Hot and cold compresses. Heating compress, that means a cold compress covered. Cold mitten friction. Ice pack and or ice massage. And a steam bath. And by steam bath, when all of these books were written, as far as years and years ago, we're talking about in the late 1900s, all this whole system of treating people was in the late 1800s, I beg your pardon, coming up into 1900s. This system of treatment was set in place so people knew how to do it. There was only steam baths. There was no such thing as an infrared sauna. But infrared saunas are fine too. I just want to preface that because somebody will come to me and they'll say, well, what about an infrared sauna? As long as you can get sweating. That's it. That's the point. Okay, caution in all treatment, and we must preface it by this. Any feeble patients or any chilled patients. So if you've got somebody who is quite feeble and quite sick, it's not the treatment to give them. You can think of more of a localized treatment. Yes, there's some things you can do, but you need to be careful. avoid children under 3 years old. Don't do it on young children. And take extreme care with insulin-dependent diabetics. Listen to what the reason why. It's not just because they haven't got blood flow to their legs. Just listen to it. They are less sensitive to heat. The heat increases metabolism but does not increase oxygen to tissues. As a result, imbalances cause cells to die from oxygen starvation and instead use a compress to lower abdomen and upper thighs. So you can adapt it to somebody who is diabetic, but you need to be careful. And I'm just saying just be very, very cautious. If you've got a diabetic who still has quite a bit of feeling in their legs, you still have to be careful. But you need to apply heat in diabetic patients who have not developed peripheral neuropathy, and you must use not as hot water and not as cold water. So you need to be careful in some cases, but you really need to know what you're doing and watch it very carefully. So my suggestion is if you're brand new on it, don't go near diabetics. Okay. Because you can cause them harm and, you can cause them damage. So that's my suggestion to you on this particular treatments. Effectiveness is diminished by eating just before or after a treatment or by heavy use of sugar and oil, by most drugs and by alcohol. Now, I can remember back to the years when I was always told by my parents, don't go swimming straight after you have your meal. Wait for a couple of hours. But nobody seems to tell anybody that now. Yeah, I can hear people saying they can remember it too. But we don't tell that to our kids. They're just in the water and they don't realise it does have an effect on you. Now, I'm going to share with you a hot foot bath. Now, that's the very first treatment that I'm going to do. And I'll get the stuff, Simon. Okay, and he's going to bring it. I'm going to actually demonstrate this to you. And I'll talk about it first before we start. And this is one of my classes. Some of the ladies in there, they just loved it. They are having such a great time. They sit there and they have all these things. And some of them, this was the particular one on the water treatments. I don't know if you can see it too clearly, but they just loved it. Now, the reason for a hot foot bath. Now, congestive headaches and migraines. Now, what I'm going to talk about is a hot foot bath. Actually, I'll just talk to you. It says 7 to 20 centimetres above the ankles. What we're going to do is we're going to put water in a dish or a bowl or whatever you've got, and I'm going to let somebody just sit there and their feet are going to be heated up. And I'm going to have ice on the head, and I'll show you in a moment. But the point of it is you will get a better response if you have your water quite a few 7 to 20 centimetres above your ankles. Now, when I took that particular photo I took there, the last one, those bowl is only about that deep. These now, I'm going to use this bucket, which I bought from Aldi, which is excellent. But the problem is it hasn't got a very good handle. You don't want to lift it up by the handle when it's got water in it. But it's excellent as a foot bath because it's nice and deep. And can you see it's nice and so it comes up nicely. So that's what I'm going to use as a foot bath. What do I use it for? I use it for congestive headaches, migraines, congestions in eyes, earache, chest, pleurisy, pelvic cramps, prostate disorders, your dysmenorrhea, or for period pain, you use ice over a stomach and not on head. When sitting in bath, you can have ice over a stomach. So, what I'm going to share with you is the migraines first. When I very first learned about this, I was helping out at a health clinic, and my turn was to be was on night duty at this health clinic, and they were taking in patients who were coming. They were fasting. They were doing detox fasting, and this one lady was a coffee drinker. Now, can I tell you, to come off coffee is one of the hardest drugs to come off. I have a friend who has worked and done these treatments for years and years, and she told me that it is harder to get people off coffee than it is off heroin or any of the hard drugs when you're treating them to get them detoxed. Coffee is the hardest one. Now, getting back to my story, I was there, and then night time, I was on duty overnight. So right in the early hours, somebody knew where to knock. They came knocking on my door. They said, "Oh, I've got this terrible headache." She was coming off coffee, all right? So what do? I just got up and I did a hot foot bath. And after probably about 30 minutes, she said, "I can't believe this." She said, "I didn't think you could get rid of headaches just like this." I said, "Yes." And that was the first thing that really convinced me how powerful water treatments were, because I was just trying it all out right back at the very beginning. But since then, I've also known, and the treatment that I'm going to share with you is one that you can use for migraines too. I had a class once, and the lady was in my class, and she just sat there, and all of a sudden she sort of just shrunk down in the chair. And a friend said to her, "Just take no notice of her, she's got a migraine." So after the classes left, I went over to her and I said, "Would you like me to do a foot bath?" And she sort of nodded in just very, because she was obviously, you got a migraine, you know what a migraine is like. Okay, so I went and I did the foot bath on her, and after 30 minutes, she was fine. Actually, I should preface this and be honest with you, because it may not take every little bit of pain out of it. She said before she started it would have been a 9 or a 10 out of a 10. When I finished the treatment, it was about a 2 out of a 10, and she was able to go home and sleep it off. And she said never before has she ever slept off a migraine. And she was absolutely amazed at the power of this. Now, that's a migraine. If you've just got an ordinary headache, number one, if you've got an ordinary headache, often that's a sign that you're dehydrated. You need to drink more water. But if you've been drinking a lot of water and you've still got a headache, try the foot bath. It is worth it. But obviously, you need to have, and I want to just urge you to start getting all your supplies and have them in a place. If you've got a headache, the last thing you want to be doing is a person having to hunt it out and look for your buckets and look for your ice and all that. You're just not in the mindset to do this yourself. Yes, if you've got somebody else there, but if you live alone, and sometimes if you live alone, you've just got to force yourself to do it because you know it will help you heaps. So you have to have everything ready. It's like if somebody said to me, "Would you come and do a treatment on them?" I actually have all my towels. I have them in a bag. Just a normal bag. Everything is ready to go. So when I go out then and I do a treatment, all I've got to do is I've got everything ready. All I've got to do is take if I'm going out and doing a fermentation treatment, I'll take my table and I'll take my microwave oven, which I do not use microwave for cooking. I want to let you know that. I'm using this for heating packs up, and they are excellent for heating up packs. Getting back to I was saying that have all these things ready there. Get your towels sorted out. Know where they are. My towels are specifically, I use them for hydrotherapy only. Now, if you haven't got just hydrotherapy towels, you need to, you can use ordinary towels. You can use it. Just use what you've got. But because I'm doing a lot of this, I actually have my own designated towels that I've got set aside for this hydrotherapy. Now, going down there, pelvic cramps or prostate disorders. Now, I had my granddaughter, she was probably about 16 at the time. She came in with it was probably about 2 o'clock in the morning. She came, she says, "Oh, Nan," she says, "I've got these terrible, terrible period pain." She was cramping and she was crying in agony. So I got up, got the buckets, did a treatment on her. She sort of lay on the couch. I had a leg over her. She just had her legs in the bowl. And I didn't put ice on her head because she had no colour in her head anyhow. She was just completely white. But if you're in period pain, you put ice over the stomach. But after probably about 25 minutes, I said, "Okay." She said, I'll go back to bed now. And she just went off back to sleep, just like that, as young people can, as we know now. Okay, but that is what you can do for period pain. And by the way, too, if you've got girls and you know any of young girls, they have incredible cramping, please make sure they keep their feet warm. One of the critical things, especially in those first 2 days, they have got cold feet. Once you've got cold feet, your blood can pool in your abdomen and it stays there. Okay, it doesn't move out. And that's what causes your cramping. So make sure your feet are warm, even in this weather. I mean, now that I think it'll start to turn. It's been very hot. No, it is not as hot as normal, but in the hot weather. But even in this weather, you need to put socks on your feet. Don't think that you can get away, keep your feet warm, and that will save you from cramps. Such a simple thing, and nobody's telling the young girls about it. Okay, it is used for preparation for other treatments. It warms the body and relaxes and comforts. It reduces fatigue. It's good for common colds, sore throats, and influenza. By the way, too, I also was telling one of my friends about it, and she'd had pleurisy. So I said, "Do a hot foot bath." And she says every night she did a hot foot bath faithfully, and she said it took the pain out. And she says the night she thought, "Oh, look, I can't be bothered doing it," she said that night she suffered. So she did it again the next night. So it just proved to her how important it was. Gallstones, renal colic, and many other disorders. Relieves abdominal pain. So what it's doing, it's going to pull the blood that is pooled wherever. If it's pooled in your chest, it's going to pull it down to your feet. If it's pooled in your abdomen, it's going to pull it down to your feet. If it's pooled in your head, as in a migraine, it's going to pull it down to your feet. That's what you need to realise. I think that's the last one. Now, what I'm going to do is I'm going to get somebody. Now, has anybody here got a headache or any other ailment they'd like me to try it on? Okay. Come up here. Now, what I'm going to do is I'm going to do a treatment. No, I've got cold water here. Now, what I've got is a bucket full of hot water. It's hand hot. I think she could handle that. Could you handle that? Okay. Now, what I'm going to do is I'm going to put some ice. Just wait a little bit. I'm not quite ready yet. I'm going to put some ice, and because I don't want to wet your hair, I'm going to put some ice, and I'll just put it in a old towel, and I'm going to sit this. You can also put ice in a bowl or a bucket, and you just have hot water, cold water, ice water. Now it's ice water in here, and you have that, and you put it over the head, like that. And you keep a head cool, right? Iced, like that. But what we're going to do is I'm just going to put this on here, like this, as a cold pack. Now, can you feel that now? It's cold. It's cold. It's a whole lot. I'll put it on in a moment. Now, so the procedure is The water is in here. It's not too deep. I've got a little bit of room for it because it's going to get cold. It's going to cool off. So I've got a jug boiled here that's ready to, she will lift her feet out to a part of it. Okay, so we'll put her feet in there and we'll get her going. And while she's sitting here, maybe we can talk. We can still talk, and I can talk for some more. Okay, yes, you can put your feet in there. Actually, what we'll do is I'm going to actually have a prayer first because I know she's suffering, aren't you? Heavenly Father, we just pray for a blessing on this. May you reduce the pain she's feeling and her symptoms that she's feeling. Please bless her, we pray in your name. Amen. Now, I'm going to put that now. Is that going to be too comfortable? Uncomfortable? Can I just leave it there? Maybe if you can yeah. I'm just doing that, so I'm not going to mess all the hair up, and I'm just going to wet it, okay? So as we're doing that, she's just going to sit here quietly, and we'll come down, and we'll just add some more water later on as we're going through. Let me know when that's getting a bit cool. Marilyn, if you could come up here and we can just add the more water as you're going along. Just stay by here and we can add more water in a minute, okay? Now, we're not going to just sit here and wait for the 20 minutes or that she's in there for. We're just going to move on, and I'll talk about some other treatments, but as she's going there, you can maybe hold it on her head too for her, yeah. Okay, so we'll do some other we'll go through and I'll talk you through some other treatments. I'm not going to do all the treatments because we will be here for hours. We haven't got hours to do this treatment. But just keep it, tell her, when it's, you need a little bit more water. Still hot. Now, when I'm going to tell you, Marilyn knows all about it because she's trained her in all this. But what she'll do is she'll lift her feet out of the water, and Marilyn will add some hot water from the kettle in there. She'll just put a little bit in at a time, making sure she doesn't burn. We don't want to burn anyone. And then when we finished, the last treatment, when we finished, we're going to put some ice. We'll tip that ice out into some water, and we'll splash the ice water over the feet to finish off the treatment. There's some cold water here, which I've got here. I'll just put in there. When we finish, we'll just put the ice in there and we'll tip it over her feet. Okay, so what we'll do is we'll continue on and we'll just what's your name again? Christine. We'll let Christine just sit in, see if she can get some relief. Okay, now we're going to talk about the next one while we're going through. Now, this is a similar treatment than what I've just showed you, but this is using two of those, it's contrast bath. And where do you use it? You can use it, I'll have to just move over here. Immersing body parts first in hot water, then ice water by using two separate buckets. Or whatever now where do you want to treat? If you want to treat your hand, you can use a bucket. If you want to treat your leg, you need a bigger bucket because your feet need to fit in. Now, sometimes those 20-gallon drums, those containers are great. Sometimes I've had some men who were treating their knees and they actually put them in garbage bins. What you need is a hot water in one, ice water in the other. Now, you need also to have a kettle there so that you can continually top up the hot water. Because when you go backwards, forwards, one to the other, you will find that it cools down. The hot water cools down quite markedly. Okay, so you can use buckets, you can use garbage bins, you can use washcloths, you can use anything like. Once again, caution diabetics, you don't want to try any of them. Okay. Now, if you're going to do it, you could, as I said, you can have 2 bowls. Now, if you were wanting to do it on your sinus, this is how you do it. And sometimes what I use, the hot water one, I have right sitting in my bathtub underneath the bath tap. Then I have the ice one next to it, and I'll sit on the edge of the bath and I'll put my foot or whatever it is in the hot water, and I want to add more hot water, I'll just add the bath water. Sometimes I will use it, and I will use my hand basin, and I'll just fill up my hand basin, and I'll use that as my hot one, and I'll use an ice one to the side. For instance, if I wanted to do it on my sinus, I would use the hand basin, and I would use a bowl with ice water in. So what would I use? I would get a couple of face washers like this. One is hot as you can handle. One is ice water. So then what I would do is over my sinus, I would just go with the hot water, I just go over there. Yes, okay. And then I won't do that again. And then I'll do the cold. And then I'll go back to the hot. So how long do you go? You know, there's not a general rule. Some people say that you can go 3 minutes hot, 30 seconds cold. Now that's a general rule, but sometimes I go faster than that. I don't wait 3 minutes. I go maybe even 1 minute. The cold is always quicker. So what's happening then? It's bringing blood to the area and it's pushing it away when you give the cold. Then when you put the new hot on, you're going to bring fresh blood to the area. Then you're pushing it away. Every time you bring blood to the area, you're bringing in new nutrition, oxygen, more white blood cells. Then you're pushing it away and you're pushing the toxins away. So once you get your blood moving, you will heal much quicker. And remember, your blood needs to run quite thinly too. So remember, hot, always keep a separate washcloth for each one, and then then you can put the cold in there. Now, somebody told me that you can use a snorkel for your hot one on your face, for your sinus. Well, I tell you what, I don't work too good with a snorkel, I can show you. So, if that's your scene, you can use a snorkel, fine. But this to me is so much easier because I find that that's much better way to do it. So that's the way you do it on there. Or if you've got a shoulder and you live by yourself, a shoulder injury, you could do it on your shoulder. There's certain parts of your body that you can't put into a dish or a bowl or a bucket. You can't do it. But you can do it this way. So this is a simpler way. There are more ways as I'm going to go through as we're talking about them. But this is the way for a contrast bath. Now, okay, you can use it for localized infections. You can add charcoal to water. And you use it for muscle or joint pains, for arthritis, for edema, swelling of body part due to fluid retention. Your blood vessels, any blood vessel disease of the veins or arteries to the leg and to the feet. Right? So you need to get it going. You need to... Now, if you were going to have, let's say, and Maria last week had a poultice on the back of her leg because she got bit by a cat. Quite a nasty bite. Now, if you've got an animal wound, my suggestion is to do contrast baths. You do it in a dish or whatever you want to do. If you've got on your leg, you would put it in a larger bucket and put charcoal in the water. That's going to help. If you don't have charcoal, you could just use plain water. But charcoal in the water will really pull the toxins out, and it will stop any poisoning from the animal bite. So if you have a dog bite or something, and sometimes it's just puncture wounds, and it can be quite painful, but that's what you do. Hot and cold, hot and cold, hot and cold. Get the blood moving to the area, and they're pushing those toxins out of the area. Okay, so diabetics, you improve circulation. Don't use hot and cold water. You use less contrast in temperature. You can use it for leg ulcers, and you can use it for your sinuses, which I've already talked about. Now, next I'm going to talk to you about a Sitz bath. What is a Sitz bath? Now, this is a picture of a woman sitting in a Sitz bath. Now, I want you to see the principle of it. She is sitting in a bath with her bottom part in her body, and the water is about up to her navel, and her feet are in a separate dish. Now, I want you to know when you do a Sitz bath, you need 2 of these. There's only one picture there, but you need 2 of them. You need 2 baths to sit in, and 1 extra one for the feet, which you can just use any foot bath for the feet. Now, what do you use a Sitz bath? And the foot bath is always about 1 degree or 2 degrees Fahrenheit higher. You know, I find it very difficult because when you convert Celsius to Fahrenheit, it is very difficult. It's much easier to work in the old Fahrenheit because 98, 99, 100, those are the temperature. But when you convert it to Fahrenheit, to Celsius, you've got a fraction, you know, and it makes it much harder. But your feet need to be a little bit warmer. And what do you use it for? You can use it for painful menstruation. You can use it for hemorrhoids and fissures. You can use it for bladder and prostate inflammation. You can use it for folliculitis or other skin problems in the perineal area or on the buttocks, abnormal vaginal discharge, inflammation of ovaries, pelvic inflammatory disease, cellulitis, postpartum perineal care, and atonic constipation, loss of muscle tone. Now, this is a particular one that I've got for us. This is you don't have to have a round one. Just use your imagination. We went to Bunnings and I got this from Bunnings. Now that's as long as you... One lady, she said, when I was in Bunnings, she said, I actually tried it and said, she tried it, make sure she could sit in it. You know, you've got to make sure you're going to fit into it. I don't get it home and it's too small for you. But you can sit long ways or you can sit sideways. There's no rule that says you've got to sit a certain way. But you need 2 of these, and they are ideal. Now, can I tell you, what do they do? Anything in that pelvic area, it brings blood into that area. And by the way, too, every particular treatment, you build on one. And if you do these treatments for 1 month consecutively and don't miss it, you will have incredible results. Now, I'll tell you a story. A friend of mine, she had... was near Melbourne. She was treating people and she treated this young boy. He was 16 years old and he had a leaky bowel. And he was very embarrassed because he was at school and he had a leaky bowel and he was like you know what it's like when you're 16 years old. So she took him in and for 1 month he did this faithfully. Every day he did hot and cold. And what you do is you sit in that hot bath with your bottom in that bath and your feet in that dish, which is hot water. Then you swivel around and you get into the ice with bits of ice in there. And you get your bottom into the ice, in the ice bowl, you know, like this, dish, whatever it is, leaving your feet in the hot water. So your feet remain in the hot water, but you swivel backwards and forwards. And that has incredible healing power. And after a month, that boy was completely healed. Can you see how powerful it is? Remember, it said it tones up your muscles. So, incredible stories when you have hydrotherapy, Sitz baths. They can be used for so many reasons, but usually it's pelvic reasons, and that's it. But if you have once I was asked, one woman said to me, "Oh, what do you do for my elderly mother? She's 80. And I thought, well, I'm not going to do a Sitz bath on an 80-year-old woman because they're not going to be getting in and out. You have to have somebody who is able to get in and out of a Sitz bath. So if somebody you can't do that treatment on somebody who is incapable of getting in and out of a bath. You have to think of a different treatment. Do you want to put some more hot water in there? Okay, now we're going to talk about ice massage. Simon, can we get the ice massage out of the couple of those? Okay, now this is for acute painful joints, muscles, infections, strains, sprains, spasms, inflammations of muscles tissue, acute back and neck pain, relieves pain, swelling, congestion, any injury, decreases blood flow, decreases deep tissues, bleeding, decreases nerve responses and spasms and sprains, contusions and tissue injuries. Okay, so what we're going to do here, if you have any ice and you start massaging it around somebody and you've got some on somebody's shoulder like that, you find that you can't just have a lump of ice in your hand. It gets too cold. So what you do, actually I'll continue, this is a little bit more, this is for ice massage. Acute mastitis, arthritis and bursitis, mastitis and painful breasts, mumps and swollen glands, lymphatics in groin, increased heart rate, shallow breathing, fever, to stimulate a reflex reaction, for example, ice on head and a hot foot bath, and increased heart rate. So you use ice for quite a few things. Now here you've got, this lady was being massaged, ice massage. So what you do is you actually, if you're doing, and it's ideal for the shoulder and neck area, and especially if you've got a husband or a spouse who is, and you don't have access to get a massage therapist, this is a way you can, and you can even do it yourself. But can I tell you that it drips? You need to protect your clothes, right? So I would like this. What happened? We had a towel around that lady. And so what she did then when she was, what we done, we have a styrofoam cup frozen. I've frozen this. And then you just break down the edge of it. And you break down the edge of it and making sure as it melts to keep the edges, because it does get scratchy if you let that styrofoam. And that's the way you just rub it over your wherever like that. And of course you can see my arm is melting. If anyone wants to do that now, here. I've got two of them here. Do you want to take them over there with you? You can take yes, you can have one. There is a towel. And here, there's I'll grab you, wait a bit, I've got what do I do with it? A smaller towel here. No, here it is. So don't forget, as it's melting, to keep breaking off down that cup. Now, there are 4 stages in it. First of all, you will feel cold, your blood will flow and it will decrease, and you keep that going for 2 to 3 minutes. So your other friends need to be sitting there next to you telling that. Then you will feel a burning feeling at about 4 minutes. Then you will feel an aching short duration, and it starts to go pink at about 5 minutes. And you have relative numbness at 10 to 15 minutes. Now, when stage 4 is reached, the treatment is terminated. Simple as that. Now, that's in your book if you're not sure what to do. It's in the book, so you've got it written down. So that's the stage of ice massage. Now I'm going to talk to you about hot and cold showers. Now, it's not as easy to do a hot and cold shower as you think. Even now, after I'm so used to it, I tell you what, sometimes I balk. But I get my mind set and I said, no, this is not. I've got to be strong. I've got to do it. If I can't stand this hot, cold shower, you know, you've got to be a little bit tough in life, haven't you? It's self-discipline. Okay, so you direct the shower to specific areas. For example, your liver, your thyroid, or your back or your neck. Now, by the way, too, I'll backtrack that. When you're doing this hot and cold, if you have an underactive thyroid, you do hot and cold on your thyroid area. If you're underactive. If you've got an overactive thyroid, you just do ice. You don't do the hot on there, you just do the ice on it. Okay, but for the hot and the cold showers, you just direct it to the part on your body. Let's say I have got a bit of a bad back. My lower back is just playing up. So what I'll do is I'll stand in the shower and I'll let the water just come on. After I've finished my washing of my body, I'll stand and I'll let the water heat up that area. Then I'll turn it to cold. Now, the idea is to get it to 30 seconds cold. Can I tell you that that is not easy? I would suggest you very first time you do it, do even maybe 2 or 3 seconds cold. Then go back to hot. Then you leave it for maybe another 30 seconds on hot, then go back to cold. Now this time you can handle, 10 seconds. And each time you will up the little bit of you'll increase the amount of time that you can have it in there. They're just adding a little bit more water. So when you have the cold, as I said, when the cold is on, the idea is to let it for 30 seconds cold. Now, if you can go backwards and forwards about 7 times, that's ideal. Okay, it reduces inflammation. Now, something as simple as that. It relieves fatigue, depression, and that is like a mini shock treatment. Now, I've actually done a course called the Depression Recovery Seminar, which and I believe they've got one of them coming for this church here too. So if you're interested and you've got depression, Dr. Neil Nedley in America has got an incredible course on how to recover from depression. And there's some simple things that you can do can help you recover from depression. And did you know just one of them, is a hot and cold shower. Now, have you heard the old way that they used to treat depression? They would give them shock treatment. Well, guess what? This is your own shock treatment. And it is. When you get in there and you hear, wow, people will scream when they get the cold on them. It can be like that. Beryl. Nice. You know all about it. That was Beryl's photo up there before with her. She knows all about it, yeah. Okay, but it relieves fatigue, depression, and you do, as I said, the hot and cold. Acute nervous irritability, or example, excitability and panic attack. Use at the first sign of a cold, flu, sore, and a sore throat. Now, if you're coming down with a cold or a flu or something, and I don't care even if it's not time of the day that you have your shower, go and have a hot and cold shower immediately. Go back and put it hot, cold, hot, cold, hot, cold. And you know something? You will boost your immune system. Now, it is not as effective as some of the other treatments, which I'm going to show with you later, but it is a help. It helps quite a bit. That helps enough. And many times if I felt like, I feel like a sore throat coming on, I would do a hot and cold. And use it the first time. Now, another one that you can do, now this is the one that you've got to be brave to do. In the winter, the daily cool bath trains the skin to react promptly and lessens the chance of taking a chill. Now, this stimulates the thyroid to normal activity, keeps the bone marrow functioning properly, strengthens to prevent getting colds, physical and moral development is strengthened. Now, isn't it interesting? When I came across this, how many people have got low thyroid? Did you know that if you have a daily cold bath, it helps prevent having your thyroid inactive? But who of us are really inclined to it? Have a daily bath. I want to share, I found this statement and I just wanted to share it with you because I think it's incredibly profound. Okay, another thing, and this is about a woman. She was writing, and she wrote it about her grandmother years earlier. Now, this is the time when they were doing all these treatments, okay, in the early 1900s. Okay, she wrote about the grandmother. Another thing that my grandmother had us do was take a cold bath each morning. She did this faithfully. I recall amusingly that many times I would sit on the edge of the bathtub trying to muster up enough nerve to plunge in the icy water. After doing so, any sleepiness that I had was gone. Throughout the entire day, I felt refreshed. It was grandmother's policy to take a warm bath at night to relax her and the cold bath in the morning. She felt that if our systems could take it, we should do it, but if they could not, the practice was certainly not mandatory. So I just thought that was cute. Okay, a steam bath. Another thing that we can do, which is to increase our body temperature and metabolism. It has a sedative effect after 15 to 20 minutes. Can you sit down for a minute? Okay, yeah. To induce sweating, yeah, that's it. Increase pulse rate, increases blood pressure and the blood flow to the skin. It increases the blood number of white blood cells circulating in the blood. You use it for rheumatoid arthritis, low blood pressure at the onset of cold or influenza. Now, the one thing you need to realise, if somebody's got rheumatoid arthritis, they cannot handle ice. You need to be aware of that. Don't go ice with rheumatoid arthritis. But there's a lot of treatments you can do for those with rheumatoid arthritis. So you can do the steam bath. Okay. To increase body temperature and metabolism, it has a sedative effect after 20 minutes. To induce sweating, increases pulse rate, increases blood pressure and blood flow to the skin, increases the number of white blood cells circulating in the blood. Used for rheumatoid arthritis, used for blood pressure at the onset of cold or influenza. Now, this is a way that you can, if you don't have a steam bath at home, you can create your own steam bath. And I can remember back years ago, this is my friend Marilyn, and years ago we were at her place and she had a swimming pool in the back, and we did this on her back porch. And as we would finish, we'd go and jump in the swimming pool. And this was in the middle of winter. And you didn't feel it. Once you're so warm, it's like those, in the Scandinavian countries, they have their saunas and they go out and roll in the snow. Because you're so warm and it is so good for you. Now, can you see that? There's a picture of that in your book, so if you're interested in that, I haven't got time to go through it, but you can use just a kettle or a jug, the one that doesn't cut out. You need to have one of the old-fashioned ones that will keep boiling. We've done it with electric frying pan, but you need to make sure that you aim the steam, that the steam doesn't burn the person. But you know what? You can quite easily do it. It's not hard. Now, a heating compress you use for pain, infection, inflammation, swelling, cough, and more. The heating compress is an application of a cold, wet cloth or compress and then covered. There's initial cooling which lasts up about 5 minutes, followed by a warming up and an increased circulation. The compress applied cold soon heats up through the reaction of the body against the cold. The trapped heat increases the temperature of the tissues. And so what we're going to do, you can do it. This is, if you're coming down with a sore throat, you can get an old piece. Now, this is just an old piece of sheet. If it's a little bit thin, I would put double. You would dip it in cold water, which I'm not going to do now because I'll mess everything up here. But you dip it in cold water and you wring it out like that. Hand wring it out. And then you put it around your neck like that. Then you place some plastic over it, which I've just got some old bags cut up, put it over there, and then put a scarf around the outside of that. Now, what you're doing is you're creating a little mini heating compress in there. And that's going to, even though that's cold, it will very quickly be warmed up by your body. And you can stay, and if you're coming down with a cold or a sore throat, this is ideal. So you put this around your neck, I say, and it's cold. It doesn't have to be icy, it's just got to be cold. Yeah, it really does. Yeah, it helps. So you do that around your throat. You can do it on your chest. You just cut a different piece of cloth, a different shape, and you can put it on your chest. And once again, you would, a little bit larger than that, but you'd put a piece of plastic on it and maybe put a tight T-shirt over it to keep it in place and keep a really thick woolly jumper over it. Make it warm your body up. Over your abdomen, you can apply pain and infection for sedation, chronic ulcer, active hepatitis. You can have it for backache, ulcerative colitis, for chronic indigestion, chronic stomach problems, nausea and vomiting. And this is the one that you can use, safely treat for a woman who's got morning sickness. You do it over the abdomen, just this wet sheet, and her body just reacts to it. And they say that probably she gets rid of her morning sickness for about 2 weeks, and then you do it again. But that's another. I'm not talking about all these. I'm just whetting your appetite to let you know that you can do all these. You can do it for chronic congestion of the liver. So you can put a pack on your liver area. You can do it on your knee or your elbow. You can do it anywhere. And you could do it on your feet. Now, this is one that I have done for so many years. I've even got these. These are ones that I have beside my bedside table. For feet, for cold, for insomnia, use your thin, wet socks. So these are my very thin socks. And what I do, if I know I can't sleep at night, I will get up, I will take my socks in, I'll go in and I'll wet them, and I'll put some thin, wet socks on my feet. And I've hand-wrung them like that. Then I get a plastic bag, I put it over the top of that, and then I put my thick socks over the top of that. And then I'll go back to bed. Now, most of the time you can fall asleep. Occasionally you may not, but I tell you what, if you get up in the morning, you will not have that thick head, which if you have a night that you haven't slept, you'll get up in the morning and you'll feel very fuzzy in the head, but you don't. It's completely clear. So that is excellent for insomnia. Now, the clue is to get it early enough. If you don't lie there for hours and hours and hours and hours. And once you do it, because what's happening, your body is sending blood to your feet area. And it's pulling it away from your head. Now, there's another one. You can do it on your entire body, excluding your head. And this is called a wet sheet wrap, and eliminates toxins, nicotine, infections, mental illness, addictions, insomnia, delirium, alcoholism, gout, bronchitis, common cold and influenza, and fevers. And if you're coming and bringing somebody out of a fever. So you can do this, and this is ideal because, as I said, I was running a program down at a place called Highwood at the time. It's changed its name now, but it was Highwood there. And there was a man in the class who was wanting to come off smoking. And so this is the ideal treatment for people who are coming off smoking, and just takes their cravings away like that. Next day, if they want another treatment, give them another treatment. And then you do it and give them another treatment. Now, the way you wrap the body is a particular way, but their whole body is wrapped in a wet sheet. And then you bundle up clothes onto blankets on top of them so that they really heat up and you get very, very hot. Sorry, do you use what? No, what I normally do is I just put a round, I usually use a shower curtain or something. If you're going to do this one on the bed, you have to have a protective covering down on there. But often the blanket will get quite wet when you've finished it, because they will really detox. I knew one man, he told me when he did this, he was a baker. That was his profession. And he says when he did this, he could not believe it, because when you see this, what comes out, and the sheet was stained sort of like a purpley colour. When you're taking people off nicotine, you'll get when you take them out, the sheet will be stained like a yellowish colour. Doesn't always happen, but often it does. Okay, another one is a salt glow. This treatment uses salt and friction over the surface of the skin until the skin glows with a fresh supply of new blood. So you can actually just get salt after you shower or whatever. You stand in, you get rub salt up and down your limb, and it really stimulates the circulation. Sometimes some people have actually had, you can buy these rubs, these beauty rubs and things like that have got things in it. Well, this is the way to go, just pure salt. Mild euphoria, give benefits and effects. Mild euphoria lowers blood pressure, stimulates circulation, increases perspiration, increases nerve activity, and can reduce heat. Now, there's only a couple more before I want to go into the doing the fermentations, hot fermentations, is cold water treading. Now, this is something coming up which you can do in the wintertime. We have a tub at home that would be about this round and about this deep. You know, it's like a big flower pot tub, you know, quite a huge one, but it hasn't got the holes in. You know, you can get them from Bunnings. Okay. Now, what you do is you got them outside at night time before you go to bed. You get up and you step in there and you just step. And you step there. We step probably at least 1-2 minutes. And I can tell you what, it gets cold. And you get up out of there and you will try your feet, put socks on and go to bed. And you'll sleep like a baby. It strengthens the system, it activates the kidneys, the bowels, the bladder, facilitates breathing and eliminates flatulence, insomnia, aids in recovery after illness, restores health, creates tone, overcomes poor circulation and creates new circulatory patterns. You can use it on your cold hands simultaneously. But you don't use it if you're chilled, right? You have to be warm before you start. But that is ideal. And the other one too is wet grass walking. By taking your shoes and socks off and walking in the wet grass, or the grounds our body when we touch the earth, we get rid of excess electrical energy we generate. Some people never walk on the bare earth or grass. It's great to walk on the earth each day. Avoid rubber-soled shoes. They're great for insomnia. And most people who've got insomnia, when's the last time they've been out in there? I think we can take it out. Yeah, take it, put the ice in there, break the ice out. It's in a bag. And then pour them over her feet. We'll finish off now. Yeah, that'd be all right. Yeah. Oh, no, we'll just make it. Look, it's easier if you pour it out. Pour it out. Go in there. Just get it to lift it up. Now we're just going to pour those ice water over the feet. Okay? Yeah, that's the only towel. All the other towels I've given away. And she will just dry off her feet. But getting back to the wet grass walking, get out and walk in the wet grass. Ideal if it's rained. At the night time, it's nothing. If your feet are warm, get out and walk in the frost in the morning. If you're warm before you start, you can handle it. Obviously, if you're cold, you must get warm before you start. Now what I'm going to do is we're going to do the hot and cold fermentations. In a moment, I'm not quite ready yet for you. Okay, but hot and cold fermentations are used to treat specific target areas, including those hard-to-reach areas such as neck, shoulders, kidneys, back, face, chest, stomach, and liver and colon. This is absolutely ideal. Can I tell you, I remember a lady came to visit me one day, and she walked in and she was really walking like this, she could hardly move. And she sat on my couch. She sat down very, very gingerly. She sort of, And I said, what's the matter? She said, I've got bursitis. I've had it for 9 months. She's had 2 injections of whatever the doctor gave, cortisone from the doctor. And she said, I'm lucky to sleep 2 hours a night. I said, well, would you like me to do a water treatment on? She said, oh, okay. She lay I actually had her on the couch because she couldn't get up. I don't think I had my massage table at the time. Anyhow, she lay on the couch. By the end of the treatment, she got up and she says, I can't believe it. Where's the pain gone? And she said, oh, down here, right down the knee. She said, maybe it's a little bit there. And I didn't go that deep. I didn't know she was right down at the knee was where she wanted. She wanted the treatment right down on the knee. It works like that. I have had countless people come into my home, and I would say out of all the hydrotherapy treatments I do, this would be the most common. People with lower back problems. Sometimes it's across their upper shoulder area, but mostly lower back. And this is ideal for it. Absolutely ideal. And obviously you can't put this in and out of a bowl or anything like that, or a dish, you have to do a fermentation. So what I'm going to do is I got my towels here. I'm going to warm this, and I'll talk to you as I go through it. But what I'm going to do, I'm going to have these towels here are going to be my fermentation. Now you can see how big they are. They're like a small bath towel. Now, if you're going to do it, you don't use your worn out towels. You need to have towels that have got a reasonable amount of pile on them. Now, you could also use, this is an old woolen one which I've cut up years ago. That was just an old one I've had for years. That's pure wool. Now, they work wonderfully too. But if you don't have access to woolen towels, woolen packs, a normal towel will do. Now, I'll tell you how I make a fermentation. I'll just pull my table over here. Sorry about that. So what I'm going to do is I'm going to wet this, and then I'm going to put it in the microwave, and I'm going to put it in the microwave for 5 minutes. I'm going to make 2 fermentations. I'm just going to have one in, and the other one is going to be on the person, and then I'm going to swap it. So the initial times that I put it in the microwave, and this is only a small microwave, so I'm going to put it in 5 minutes. The first 2 will go in 5 minutes each. Subsequently, I will put it on about 3.5 minutes because it's got a little bit of residual heat. It doesn't have to get as hot. Now, what am I going to do? I need to get my water closer. What I'm going to do is I actually use a measuring cup. I'm going to put 2 cups of water over this towel. Now, I've found that if you have them any wetter than that, they get sloppy and messy. Now, other people may do it a little bit different. This is the way I was taught, and this is the way I have done it, and I like it this way. So what I'm going to do is I'm just going to fold that over into thirds like that, half again and half again. Then I'm going to scrunch it up, and I'm going to put it in a plastic bag. I'm not going to twist. I'm just going to let this plastic bag just sit open loose in the microwave, and I'm going to put it on for 5 minutes. Then I'm going to do the other one the same. Now, as you do this, you may have to do, after about 3 or 4 changes, you may have to add a little bit more water to the packs, but that's generally enough for the start. So I'm doing the same. I'm folding it into 3, so I've got a long, like that, and then I'm going to just put this in another bag here. Now, what I'm going to do is I need another pot of ice wherever Simon is out of the freezer. Okay, so let's get this ready. Yes. So what I'm going to do, I've got a patient here who's going to come up, and I'm going to do a treatment on his lower back. I'll tell you what I'm going to do first. Thanks. Good. First of all, I'm going to do a hot pack on it, and I usually leave them on about 3 minutes. Then I'm going to put an ice pack on it, or a towel that's soaked in ice, and that is going to shock him. And I think for everyone who you do it, the least liked part of this is the ice. And sometimes they go, oh, like that. I've had some people, they actually can't handle it at all. Now, what I'm going to do is I'm going to put a dry towel. Every single time I'm going to put a dry towel down on the skin, and then I'm going to put the pack on top of that, and I'm going to wipe my hand under there as it is going in. Remember, this is moist heat. And so that moist heat is going to penetrate very deeply. Did you know moist heat penetrates probably from 2 to 7 meters in your body, 7 centimeters in your body? Dry heat doesn't do that. And that's why this is so powerful. And so you just wipe underneath it. Now, what I'm doing when I'm wiping with my hand under there, I'm dispersing the sweat and the condensation, and that's going to stop him from burning his body. Now, normally, that is enough. Just 2 thicknesses is fine, because this is, a reasonably good towel. Now, you could use a big bath towel and all that sort of thing, but I've just got it that I've used these, and they suit me well. So then when I'm going to change it, I'll put a fresh one on, a fresh dry towel on. Because the principle of it is, if you've got, it's like if you get a hot dish out of your oven, if you use a tea towel and it's dry, you don't get burnt. But if it's wet, it just travels, the heat travels right through that, and it can and it can burn you. So that's the principle of this. So what we're doing, every time we're putting that hot pack on, it's bringing blood to the area. Then we're going to put the cold on, and it's forcing it out. Then when we put another pack on, it's different blood that comes to the area. It's fresh blood. So every time you do that, you go. And look, I've heard people, they've actually had look, I can't underestimate how many times people have got up. They said, "Oh, that feels better." Now, sometimes I said, did it on my brother, and I said, "Well, what do you think?" Because he had a protruding disc. And he says, "Oh, probably." I said, "What do you think?" He says, 60% better, and that's fine, which was great for him. Then I did his for 2.5 days on him, morning, night, morning, night, morning. And after that, he said, "I think that's right. I can handle it now." So it's not necessarily going to take every single pain away from the very, very serious injuries, but it's going to help. Okay, I'm ready when you are. Yeah, just take your top off. Okay. You just get up and you don't need your glasses on. Okay, so, yeah. Okay, so what we're going to do is, I'm going to do it on this lower back area here. So, you've got to be careful when you're doing it. I'm sort of all colour coordinated here, so I know what I'm doing. I use a dry towel to get it out there, because that's pretty hot on my hands too. As you can see the steam coming up. Now I'm going to just put that over the top to keep the heat in. Now you'll find I can leave this on probably about a minute before it starts burning him, but then I'm going to wipe underneath it. That's right. And always tell them, if it's starting to burn, tell me. And what you do is you just wipe underneath. Can you see what I'm doing? Now, take notice, I'm hardly lifting up. I'm keeping it as close as I can, and I'm just using the palm of my hand to disperse all that condensation. And normally just by stroking underneath, that's enough. And you've got to hold on to it here with your hand. Really grab onto that oil, because you'll lose the whole lot. And generally I'll just wait until the next one's ready. One lady, she had to have she was told that she had to have a back operation, and she had incredibly protruding discs. She could hardly walk. She was in agony. She couldn't walk. She just lay. And she had to lay with her legs up because she was in such agony. My friend did this on her for about 2 weeks, and after that she was fine. See, don't forget, it's not necessarily something that's just going to just be once. You have to keep doing a few treatments. So there'll be...
Once a day or twice a day?
I think she did it a few times a day, probably about 3 or 4 times a day, because she was really in a bad situation. And overnight they were doing a comfrey poultice on her back, over it. So if you haven't got the comfrey root, you can use, but you can also use comfrey leaf too. That makes an excellent poultice too. Depending where you are, I've actually once I had a program in Melbourne and I was at home and I fell and I landed on my coccyx bone, you know, and I actually did this myself because you know what to do. You can actually lie on it if you know what you're doing, and I just leaned over the bench, the kitchen bench, and I just I did it on me like that. Very hard to do. But can I suggest you need to find a partner and you need to practice it on each other? You really do. Where is Beryl? Do you remember me doing this with you, Beryl? Tell them how you felt afterwards. Tell me how you felt afterwards. Pain was gone. What do I do with the gut? Now, what I'm going to do is
that was classic. You didn't warn him.
Oh, I've heard people screaming. Now, it's great if you get a pinkish reaction because you're bringing blood to the area. Okay, so I'm ready now I've dried that off. I've used that towel to dry it off. Now I've put another clean one on, another clean, dry one on. This time, when I put it in, I'm just going to do it for 3.5 minutes. You still there, Fred?
He's not answering.
Idea, you know, something that you have it done on you. You can do it on your liver. Absolutely great. This is superb. Yes. You know a friend, go around there and say, come on. Because, you know, you couldn't get somebody who is frail into the bath. But you could do it this way.
Would you do it on someone that was really sick?
Yep, you could. Depending, I mean, they've got to obviously be able to lie there, you know, if they're not in agony. Yeah. I'd like you to try it. When we did our class, all the ladies, we had them up there, they all tried it on each other. And as Beryl remembers, she was at the class, weren't you? And do you remember you also said how much it freed your shoulder up?
I never had any pain in my shoulder for months.
Yeah, did you hear what she said? She'd had a bad shoulder, and after we did this treatment, it was months before the pain came back. And what you just do your treatment again. You also had great success on the ice massage too, didn't you? It's easier to do ice massage than this. This is much more labour intensive. Plus, there's also towels to wash, which is part of it. But this is what now. Remember, I'm just wiping all the time here underneath it.
Otherwise it gets too hot.
Oh yeah, he would. He'd be hot. And that's it. I would do probably 5 changes. I'll only do 3 here today, but I would do 5 changes, and that's how you do it. Just another minute or so. It's not as bad the second time. The first time is definitely the worst. I agree. And I do feel, because I feel for you, Fred, because I know what it's like. And sort of give a little bit of friction with the wet cloth too. And obviously you've got to try to do it as fast as you can, getting the changes on. The quicker that you can change it, the better. But you get yourself into a routine, especially if you've got a microwave. Now you can actually do it if you don't have a microwave. I'll just explain that in a minute. I think that's the last one I'm doing, isn't it? This is the third one. This is the last one I'll do. I won't worry about reheating that one. I'll tell you how you do it in a moment when I've got this on. As you can see, the heat, just steam coming off that. It's hot. But you can fold those towels, you roll the towels up, and you put them over hot water, steam that penetrates them on a rack. You've got to have the rack above the water. You don't put them in the water, but you put them on in the steam. But can I tell you, I've done it that way. And I've also done it, and I'll show you in a minute another way how you can do it with packs. And I tell you what, it's labour intensive. This, I tell you what, whoever decided to do a microwave for treatments I went out and bought a microwave just for my treatments. I don't cook in it. It's in my laundry. I keep it in my laundry. So it's just there for hot treatments and hot packs. And I would heat up a hot pack in there sometimes. When you do want to do a treatment, yeah. See, as you can see, I'm all the time. See, I'm keeping it down, and that's the mistake. Most people want to lift it up, and they let the heat escape. But you just wipe backwards and forwards like this. So if anyone has a bad back and wants a treatment, well, see me and I'll give you a treatment. You come to my home, and I will do a treatment for you. And you can do, as I said, you can do it up on the shoulders. I have one lady, one of my friends, I start on her back, then I go down her buttocks. See, it's a bit hot. So I've taken my hand up. Sorry, Fred. But I go down one leg, then I do the other leg, and I fold the towel long ways right down there. And then she gets up, and I'd go on her, that'll be fine now. Then I go on her, wrong one. That was only water. This is ice water. See, what I do is I folded the towel on her long way, over three, and I did it. She's only a short woman, and so I did the whole leg, that leg, then she rolled over, and I did the front of the legs. It took me about 2 hours to do the treatment, and she got up and she says, "Oh, thank you." She says, "Oh, that feels so good. At least I can walk now."
What's wrong with your legs?
Oh, everything. Everything. She's like she's in a lot of pain, and she's elderly, so there's nothing really. It's not going to cure any. Thank you, Fred. So do you notice I finished on the cold, and that's it, and then we finished. Is he asleep? Thank you.
That's very good. Feel like $1 million.
So you can see how these do work. These treatments work so well. Okay, now is there any questions? Just hold, we got a microphone.
Oh, hello. I
Yes.
was wondering if you would ever use any oils or things like eucalyptus.
Not with that. I've actually come along, and I've done people who have actually had deep heaty sort of oils on prior to it, and I found it gets really oily and I can feel it. It needs to be. You could put the oil on after you do the treatment, but not with it. Any other questions? Oh, that looks good. Nobody's got any questions. Just hold on.
Thank you. Your address and your phone number.
Okay, by the way, I'll just run through these last slides here. Moist heat of the poultices or fermentations may penetrate the tissues and muscles to a depth of 20 millimetres to 75 millimetres. Dry heat does not penetrate deeply. This was a class I did. That particular photo was a gentleman I was doing. I always like to do it on a gentleman because it's much easier because you've got more access to the back, okay? And when you're doing a class. It's different if we were doing a class. We had all the ladies lined up there, and Beryl was in the class. I can remember that, and we had a good time. But it relieves pain, it relieves muscle tension, it stimulates blood circulation, relieves insomnia. And by the way, too, if you want to relieve insomnia, what you do is you fold your fermentation and you have it going down the spine. Right up the spine. Relieves internal congestion. I can actually remember one of the ladies I was talking to, she was actually trained years ago at the Sydney Adventist Hospital in Sydney when they were training people with hydrotherapy, and she said of a night time before the patients used to go to bed, we'd always go and give them a hot compress down their spine so they'd all sleep. Now, 3 to 5 minutes hot, which is a hot, and 30 seconds cold, and you repeat for 5 to 7 times. Relieves muscle spasms, relieves pain in nerve joints and internal organs, increases sweating and elimination of waste, increases the white blood cells in circulation. It's a strong stimulant and tonic. It improves circulation, increases muscular tone, and stimulates nerve action. Now, you can also do a slight variation of that, is that right at the end, when instead of putting the ice on the cloth, I could just rub a block of ice across that. So that's another way you could do it. It's just a slight one, and that would be ideal if you did it down the spine, because it's, you just rub it up and down the spine. Okay, this is one which I haven't got time to go through, but I want to tell you that. Another question? Okay. Just another, and I'm not going to talk about this, but you can even do fever baths. Fever baths is when you put somebody in a bath, you heat them up, you keep their head very cold, and it stimulates so many people will just knock out cancer like that. Incredible. And you put In your bath, you put some cayenne, your ginger and your mustard, which you put it into a cloth, like a large cloth, like a big tea bag. Put ice. Absolutely must use ice on this one. You would do incredible damage to the person if you heated them, because their body's going to get to about 40 degrees internally. Okay, and you're giving them a mini fever, and they must keep your heads cold. I like it. See, on the right-hand side is the Fahrenheit, and on the left-hand side, well, this is the other way around. Usually I have it the other way around. But 100 is 104. You can get the temperature up quite easily to 104. Okay, cancer cells are eliminated, increases oxygenation of the tissue. Look, it is so good, but it's another completely different subject. But the point of it is, learn to do hydrotherapy now and become confident while you have time. You may need to use them under extreme conditions, and you need to learn now. And so many people have so many problems with their lower back. But if it's not their back, they want to do it on their liver. Or maybe, you see, your legs, you can dip your legs in and out of a bucket. You can get that hot and cold there, but you can't do your lower back or your buttocks or something like that. You have to use it. You have to do something like this for them. Water treatments wisely and skillfully used may be a means of saving many lives. And don't forget this book here, which I'll send down the back. Lourdes, we'll just take it down to Nola, down the back. And if you want to have a look at that, just remember, put your order in today and bring your money in next week. It's $60 if you want it. If you don't want it, that's fine. Thank you. Now, if you want to do and watch this particular things, if you got on Facebook and YouTube, we're sort of like it's still new, but you can get it. It's on YouTube and Facebook. You look Back to Eden with Kaye. Facebook, Back to Eden with Kaye. You'll find it there. Plus, I want to do other programs. I want to do different things on there and get some more talks and some more just things classes that I can share with people. I want to have it on there. And I know it's not me. I'm not at all tech. I've just got a very, very good friends who know how to do it. Okay, any more questions before we finish? Okay, so I think we'll leave it there today. Thank you for coming. And so don't forget, next week we're going to deal with herbs. Now, what herbs? It's not just normal herbs, it's your garden weed type of herbs. That's what we're going to do. Plus your normal herbs. Okay, so I'll see you then next time. Bye for now.